So is C-section safe? You know, when a patient has gotten pregnant through IVF, for which I do a fair bit, IVF is the in vitro fertilization where the egg and the sperm is gotten together and fertilized as an embryo outside to put back into the body. So not many doctors have license to do this, and it's a subspecialty. So for IVF patients, they have tried a long time to have a baby and couldn't get pregnant. And if they are successful in getting pregnant from IVF, then we offer them the option of C-section for them to choose. Always doctor can recommend, but patient decide. For people with recurrent miscarriages, let's say 4 or 5 miscarriages before they get pregnant, we also discuss with them the option of C-section. Or if the child is born from an elderly mom above 40 years old, they also have the option for C-section. Discussion doesn't mean they have to do C-section, just that we offer them this option. Why? Because it deemed that it's safer for the baby. Sometimes C-section has to be done, you have no choice, right? For example, if the head is not presenting by the outlet pelvic area, you have no choice. This is what they call abnormal lie. Not to lie to anybody, but the lie is the position of the baby. If the placenta is low, blocking the baby from coming out, if the baby is very small, IUGR is intrauterine growth retardation. It means the baby is very small and not growing well, not enough oxygen. Or mother has cardiac problems or severe high blood pressure, PE is high blood pressure. Or if a person already had 2 previous C-section, or if they think that the baby is 4 kg and above, even if for first timer, we will offer surgery. And for people who have previously had prolapse and incontinence surgery, we always offer them C-section so that the results won't be as badly damaged. Otherwise, if they go through normal delivery again, the prolapse and incontinence results, surgery results will not be good. The youngest I've removed the womb for prolapse is a 32-year-old lady who had 3 kids. The youngest patient I did incontinence surgery is also 32 years old. I had a 31-year-old with very bad prolapse after 2 children, but we have not done surgery for her because she's just so young and she's not sure whether she wants some more children. So we use a ring pessary to hold up the womb. Right now she's 34 years old already. So this lady is actually Mrs. Singapore, Mrs. Asia, and 3rd in Mrs. World. I delivered 2 babies for her, and these stories I can tell you because it's in the papers anyway. So I delivered 2 babies for her, normal delivery, easy. The 3rd baby, somehow it was breech presentation, which means the backside comes out first instead of the head. So just now we went through backside first. The danger is if the head is too big, it gets stuck, then the baby can die. So I told her you have to do a C-section because this is recommended all over the world now. So she was very upset. She cried. She said, I don't want a scar, I don't want a scar. Can you try? I said, I'm one of those few who are trained in such deliveries now, but I think it's not safe to try. So eventually I convinced her. So say tomorrow was her C-section. The night before at 12 midnight, she went into labor in the labor ward. So I went to see her. Her cervix was opened up to 5 cm. 10 cm, you can start pushing baby out. She was in active labor. So I said, oh, then we have to do emergency C-section now. So I rushed her down to the operating theater. While rushing down, we called the anesthetist to come to give anesthesia. Otherwise, I can't do the C-section. So when we reached the labor ward, the baby's backside was already at the outlet. I can see the backside already. Then I said, we have no time. I need to deliver this baby. And I delivered her vaginally. So she was so happy that she did not have a C-section, and now that it's so uncommonly done, she went to the papers and told the story. So there's this story about Mrs. Singapore. In fact, because of the present day that every breech baby is done by C-section, the new young junior doctors have no training in delivering a breech baby physically rather than on models. So sometimes an experienced doctor is also very important. So some people request for C-section. Just now, Kenneth was asking me for many reasons. Common reasons include they're afraid of pain. But of course, after C-section, they can still have pain, but they don't go to labor pain, which is the worst pain a woman can experience in her life. Some people worry that the vagina will relax and affect their sex life. Right? Some people worry about stretch marks. I had a patient once, some years back, at 36 weeks, She was very lucky. Her first stretch mark appeared only at 36 weeks. Once the first stretch mark appeared, she came to see me and said, "Doc, I want to do a C-section." I asked her why. She said, "Because if I continue for another 3-4 weeks, more stretch marks will come. It will be so ugly." So we had a long discussion, was insistent, and she had to sign a lot of papers. Eventually, we did a C-section for her. So some people do it for horoscopic reason. They select time, date. Sometimes I do it for people at 3 a.m., 5 a.m. Can be quite challenging. And then Singapore Airline girls, I deliver quite a number of them. And in my group of SQ crew, 75% and above ask for C-section. The reason is that all their friends are doing it. They're all doing quite well, so they're quite comfortable with it. I also deliver quite a lot of Japan Airlines crew, and majority of them want normal delivery because all their friends are doing it. So sometimes it's not whether you're crew, but who you mix around with, the kind of social circle and the kind of thinking you have. C-section is not without complication, right? It can be anesthesia risk, can be bleeding, infection, injury to the surrounding structures, sometimes pulmonary embolism, that means clot going to the lungs, blocking up breathing, scarring and ugly wound. All can happen, but the risk is very low. In fact, before coming for this talk, I just did a C-section for a patient. And usually the time taken is only about half an hour.